Welcome everybody to our weekly Q&A session with Toronto's Associate Medical Officer of Health. My name is Dilshad Burman. I'm a writer and reporter with City News and 680 News, and I will be moderating this chat today. Welcome, Doctor. Thank you for joining us again.
Hi again.
So as you know, what we do with this chat is we get you to submit questions over the week, and then we ask the doctor these questions. If you haven't had a chance to submit your questions, you can do so under this live broadcast, and we're going to try and get to as many questions as we can, whether they're live, whether they're the ones that are submitted. We'll do our best. So, Doctor, are you ready?
Let's go.
Okay, so let's get started. We've got quite a mixed bag of questions, so I'm just going to send them at you one by one. Let's start with a question by P. P asks, he got COVID 3 months ago, still has a stuffy nose, both before and after they got it. Should they just avoid everyone? They're asking because by mid-December, they have to go back to work among people in construction.
So if you got COVID 3 months ago, you could very safely say that you're no longer infectious from that infection 3 months ago, especially you're not hospitalized or anything. But if you've had a stuffy nose for the whole 3 months and it hasn't changed, then you could assume that that's a symptom that you have, whether it's from the COVID that you had or allergies or whatever it is. But if you have a change in your stuffy nose, if now your stuffy nose is a runny nose or you have a bit of a sore throat, I mean, it could be COVID again. And so I would say to get tested again to confirm.
Okay. And then let's see, Vishal asks, what is the accuracy of the COVID-19 tests? What are the chances of getting a false positive? And how can you establish confidence in those tests?
So the best way to be sure that the positive that you get, if you're tested, is a true positive is to have a good, this is our medical term, pre-test probability. And that is someone who gets tested who, if they're positive, we think that that's a real positive. And the way to increase that is, you know, if you have symptoms of COVID, if you're getting tested because you were a close contact of someone who had COVID, you're getting tested because you also live in an area where COVID is more common compared to, say, other parts of the province. In those situations, if you got a positive, you would have to assume that it's a true positive, not a false positive. Where we run into more of the false positive situation is where we're doing screening testing. So we're testing people. This happens actually in workplaces, in long-term care homes, for example, where we're testing workers every 2 weeks. And it's in those situations that you're more likely to get what we would call those false positives.
Okay. Because however, you mentioned long-term care homes. Long-term care homes right now are kind of not a hot spot, but we have been seeing cases rising. So would that also be considered an area then where there are high cases? So that's still a false positive though? Would that not become a true positive given where?
No, you're absolutely right that as we've seen things change from the summer until now, if you get a positive in a long-term care home, we consider that a true positive, but we do our investigation. But I think you're absolutely right. Like it's more kind of in the summertime when we were doing testing, there was less COVID circulating and we were getting positives. Some of those investigations had to be done to see whether it was a false positive or not. And I think the other important point to say is we can do more tests, more investigation to try and help determine if it's a false positive or really you have COVID.
Okay. And Lisa asks, we actually addressed something like this last week, so I'll ask this again. Lisa says she's heard that a lot of the deaths that occurred due to COVID-19 were vitamin D deficient. Is that true?
There's no link between vitamin D deficiency and dying from COVID that I'm aware of. We know that vitamins like vitamin D can be very important for a lot of different things, but I'm not aware of that link per se.
Okay. Abbas asks, as a person with a physical disability, I feel depressed all the time and I don't feel like myself. Why haven't the governments or medical officers addressed people with disabilities in this epidemic?
So, I mean, it's a really good point. We know that there are a lot of very vulnerable people. Disabilities would be one that need to be addressed. We know actually by looking at some recent data that mental health has been a big issue in people in general, beyond just those who have disabilities. And people are still citing that they feel concerned related to the outbreak and that their mental health is being impacted. And so I think what I would say to you right now is there are resources available. You could call 211 to find out what supports could be available for you, because we definitely want everyone to feel supported and to address what their specific concerns are.
Right. And I feel like we've talked about mental health resources before. You've mentioned 211 as well as one of the places that you can call to get the help you need. Are there any other city-run resources that you could reiterate?
Well, 211 is a great place to start because they will tell you what is available for you. You can also call our Toronto Public Health Hotline, and we certainly will be able to help you as well.
Okay. Husky asks, I live downtown. I see a lot of careless people. How can it be safe to be outside at a restaurant when people are seated next to each other and speaking to each other without masks? What good is a socially distanced table if at the table there's 3 or more people? I see this all the time and I wonder about it. There's barely 6 inches between these people and they're talking at a table together.
So that's exactly right. And that's why we're recommending that if you go to eat in a restaurant, that you eat with only the people that you live with, because you cannot keep that physical distance at the table. And so if you're going out to have a meal at an outdoor patio, it's 4 per table, and that you go with the people that you live with only.
I think this messaging has not reached people. This is something, because restaurants are open, people are going out and meeting friends. And I think the messaging that you still, even if you go to a restaurant, go with your household, that needs to be reiterated for sure.
That's right. And I think that if you want to meet up with a friend, do it online, do it virtually. That's going to be the safest way to do it right now.
Absolutely. And then there's a few school questions that came in, given that the cases are rising. Lots of people are concerned by this. They're kind of similar questions, so I'm going to try and combine them. Jane and MS are basically asking the same thing. With kids being super spreaders, why are schools still staying open? MS goes on to say that there's 23 schools in Toronto that have declared an outbreak. Many of the schools are in high-risk areas with the percent positivity rate already being really high. So how does TPH plan to tackle this, considering that 23 schools with outbreaks and there's 35% plus schools that actually have COVID cases?
So we are watching this like a hawk. We watch this every day because we are exactly concerned with the questions that the viewers have said. We've done a bit of a deep dive on this and found that out of all of the outbreaks that we have in the city, 20% are related to schools, but the cases related to schools, the students only make up about 6 to 7%. And so that's one piece. The other piece is that we do have 1,200 schools. And so while 23 outbreaks are 23 outbreaks that we don't want, it is still a smaller proportion compared to the number of schools that open. Also, we know that even though many more schools have had someone with COVID related to the school, those students or staff who have had COVID that have been in the school don't always go on to develop an outbreak. And so that's why schools are still safer. They're still okay to be open, but we are certainly watching to make sure that schools continue to be a safe place to go, to learn, to work, and are keeping a very close eye on this. I think I do want to say one point, though, is that with COVID, there's no evidence that children actually are super spreaders. I mean, we think that children play that role in other infections like influenza, but when it comes to COVID, it seems that the children who attend school who are getting COVID are getting it in the community. They're getting it from their social environments, from their households. That's a common way that they're getting it. Then they're coming to school, and when they come to school with COVID, it's not necessarily spreading like wildfire in the school. And children seem to be getting it more from adults rather than children actually spreading it to others. And so, but we're keeping a close eye on this because we want to be able to be able to respond in real time to what's going on.
Right, and like you said, it seems that children are actually catching it from other adults rather than catching it from each other and giving it to each other.
Exactly, and I think the public health measures that are in place in schools are also preventing the spread in schools as well.
Okay, and then just a related question. I think you've already answered, but we'll do this anyway. Will schools be closed, at least in the hot spots right now?
Right now, there's no plans to close any schools particularly. I mean, if there's an outbreak related to a school, sometimes the school is shut down. But a broad shutdown of schools is something that we absolutely want to avoid. It's really important that schools are open for the students themselves. Actually, studies have shown that there are a lot of harms with schools being closed, but it is that balancing act. And so it's something that we are keeping a very close eye on. But right now, there are no immediate plans to have a broad shutdown of schools in the near future at all.
Okay, and then let's move on to some other questions here. MS asks, again, what is the TPH's plan to deploy or use rapid tests in schools and high-risk communities, which are already seeing high positivity rates?
So testing is actually led by our, Ontario Health, and we work very closely with them. So we've actually been having discussions with them about using some of these new testing tests that are available, like the rapid tests in schools. And so we're working with them on that right now, actually.
Okay. So more to come on that then.
Yeah.
Okay. This is a good one because the holidays are coming up. How should we celebrate the upcoming holidays and stay safe?
Right now, the best way to stay safe and to celebrate anything is to do it virtually, to cancel in-person activities, to stay home and to stay connected only with the people that you live with. That is the safest way to do it. We will see how we progress. I mean, the holidays are still many weeks away, but for the current picture, that is the safest way to celebrate. If you're celebrating a birthday right now, if someone's getting married right now, that is the best way to do it.
And then we actually have a related question from our reporter, Faiza Amin. She says that a lot of people have family within the country, but say in another city, and they travel back home to meet their families. It's probably the only time of year they actually get to see their families. Is it not recommended to do that at all? You know, if they do it, are there any precautions to be taken, or should we just cancel all of this and stay home and do it virtually?
Right now, the recommendation is not to travel unless it's essential travel. That's for sure, and not to meet and gather with people, even if it means meeting with people who you haven't met with in a while, even if it's something that's traditional that we do. Right now, that is the recommendation for the moment, and so we'll have to wait and see what our recommendation will be going into the holidays. You know, it's that gathering. We travel, we go, we meet with our family, and then we connect with them in very close quarters, and that's how the virus is spreading through that close contact with others.
Right, absolutely. And I think, like, we've talked about this so often. We talked about it on Halloween and Thanksgiving. We just have to modify our celebrations now. We also just had Diwali, and normally Diwali is a time we all gather. Personally, it was just me at home. We ate, we got dressed up. That's all you can do at this point.
Exactly. I mean, we are finding newer ways to celebrate, and with the hopes down the road that we'll get back to what we had. But for now, this is what we have to do. If we don't do this, the case counts will continue to go up, and we'll be in worse shape a few weeks down the road. And so it's up to all of us to actually make those choices and decisions to get the case counts down.
Right. And then here we go. This is interesting. Maeve asks, is it confirmed that all cases of COVID are because the person did not wear a mask during a time period when they were exposed to someone who had COVID?
We don't necessarily have that detail of were you wearing a mask, weren't you wearing a mask. You have to recognize that it takes 14 days, up to 14 days from when you were exposed to when you could have got COVID. And it's hard sometimes to pinpoint exactly, okay, it was this encounter that made me get COVID. Right. But we do know by and large, the majority, more than half of people are getting it from people that they know who had COVID and had that close counter. Often they're not wearing masks. But even if you wear a mask and you're close to one another, you're in a room that has not very good ventilation and you're with them for a long time, I mean, the mask can only protect you so far. And that's why it's that physical distancing that still is really important as well.
Right. So more about masks then. S asks, for the past 8 or 9 months, all levels of government and public health have been issuing public health guidelines about wearing masks, hand washing, social distancing, etc. In Toronto, we also have a mask bylaw. And of course, lots of people are obeying, but just as many people are not obeying the bylaws. So after 9 months of education, can the public health and city not start strictly enforcing or fining people for non-compliance so that a majority of people will comply and we're not so worried about catching COVID?
So I think the important point to know is actually the majority of people are complying. Like we actually have very good compliance. You know, from considering we started at 0, no one was wearing masks in January, and now it's a recommendation. And I think it's like every behavior change. You want to eat right, you want to exercise every day, and you have to wear a mask. And so we have to recognize that it is a behavior change. Now there are laws required for masking. The mask bylaw in Toronto is there, but also it's a provincial regulation. It's part of the Reopening Ontario Act where masks are required. But we also have to recognize that there are some people who can't wear a mask for very legitimate reasons, and there are exemptions to masks. And we have to be respectful of those people. I think we have to find ways to, if it's talking about going to a store or whatever, for those who can't wear a mask, to do that safer. But we do have to have that ability for the exemptions and not to make those people feel bad about it. Now, for those that can properly wear a mask, there is certainly that education enforcement that's ongoing. And I think what I would say is we all need to do it. Like, it's one thing to have enforcement officers who can convey that, but I think probably more effective will be if you and I say to our friends and our colleagues, you know what, it's under your nose, put it up on top of your nose, to give those reassurance for each of us, that will probably be just as effective as well.
Right. And I think over the months that we've been talking about, the enforcement strategy has been education rather than fining, because at least with these kinds of things, you mentioned that that's more effective. And like you said, if we talk to each other, that's more effective than actually a monetary fine.
Yeah, but fines are available, and often the fines are for the business or the organization related to their policies. And so fines are also part of the legislation.
Right. Okay, let's move on here. Dima asks, does Toronto have a distribution plan for the upcoming vaccine? Who gets it and when?
Very good questions. We have the immunization task force for the city that has been announced, and my colleagues in Toronto Public Health are working on that. This is going to be a very big undertaking. Toronto Public Health will wait to get to the vaccine from the federal government through the Ministry of Health to Toronto Public Health, and the guidelines will come centrally, meaning from the province, from even our federal counterparts on who should get the vaccine first. And so those discussions are starting. And when we have more to share, we will for sure share them. Okay.
And then actually we have a question coming in here live related to vaccines. They ask, what are some of the misconceptions that you've heard of related to this COVID-19 vaccine? A lot of people are afraid of taking the vaccine based on, various things that they've heard.
Yeah, I think it's important to know that the vaccine is being studied. It's going through the approval process. It's being studied in humans to check to see, does it work and how safe is it? And so when a vaccine gets licensed, we will be reviewing all of that data, all of that literature to be able to let people make an informed choice on whether they want to receive the vaccine or not.
Right. And then let's see. This is also an interesting question about vaccines. JJM asks, can the vaccine be administered to somebody who already has COVID? That person could be asymptomatic or symptomatic. They're asking because I have been refused the flu vaccine when I was sick.
Yes, so this is part of what we need to determine. Usually we don't like to give you a vaccine when you're sick, because if you get more sick afterwards, we won't know if it's the vaccine that's making you more sick or if it's your underlying medical condition or, you know, illness that you had that's making you more sick. That's one of the reasons why we delay things when we're sick. Right. But if you've previously had COVID, can you still get the vaccine? These are all kinds of really good questions that we're going to have to determine when we actually provide the vaccine.
Right. And also, I guess, depends on the characteristics of the vaccine, right? Like you said, and I suppose long term depends on whether you actually are immune to COVID after you get it once or twice, as we've noticed people are getting it. So I guess the questions all depend on the research that we do about COVID and the research that we do about the vaccine and its efficacy.
That's exactly right. Yep. Yep.
Okay, let's see. This is interesting, maybe not a medical question, but perhaps in your professional opinion. JP Milton asks, how do we provide an effective reply to people who are denying the seriousness of the current outbreak?
You know, as a healthcare professional, what I say is, you know, I've seen it. I've seen people, I've diagnosed people, and so when you see it in real life, that can change your mind if you had doubts. You know, for all of the healthcare professionals that are looking after COVID patients, who are calling people to tell them that they have a positive test, I mean, you would have to, I would say, speak to them, or you would have to actually convince yourself that the work that they're doing is actually, you know, somehow not based on truth and reality. So I think kind of knowing that real health care is being provided for people who are really diagnosed, some of whom are having a very bad illness, and some of whom, even when you tell them they have COVID, don't believe that they have COVID. So I think that's very convincing to recognize that this is actually a very real illness.
Absolutely. And I think, unfortunately, as you've also mentioned, unless it hits home, unless it's you or somebody you love, it's not always believable, or you kind of, a lot of us feel like we're indestructible and it's never going to happen. And then unfortunately, once it hits home, that's when you start actually realizing that it is really serious, and you never want to get there. So maybe just follow public health advice and follow all the smart people that we talk to.
That's right. Let's not take our chances and say, oh, it's not a real thing and I'll just do whatever I want to do, because people have gotten quite sick even though they were otherwise healthy.
Yeah, and we have a death rate to prove it. There's no denying that people have been dying over the past 8 months.
Mm-hmm, mm-hmm.
Okay, let's see. Okay, BD Rose asks, the flu is more fatal than COVID-19, yet we've never had a lockdown for flu seasons. So why with COVID-19?
Okay, so I'm not sure that we can make so I'm not sure that that's correct. Like, I don't know if the flu is more fatal than COVID-19. I think we're going to have to see as we go through this fall what happens. What I would say, though, is that we do expect pandemics. Pandemic for flu, you'll remember 2009, we had the H1N1 pandemic. It was actually a mild one, but there have been more serious pandemics where more intervention is required. And the reason why we're doing this year for COVID is because COVID is a new virus. Nobody has any immunity to it. And so that's why we need more measures, because if we let it go, we don't put in the measures. We've seen what happens actually in other parts of the world. The cases just continue to climb because nobody has immunity. Unlike influenza, even when you have an influenza pandemic, often people have a bit of immunity because influenza circulates every year and you've developed that, even if it's from previous vaccination as well. And so that's the difference here. And that's what differentiates a pandemic versus a virus that we call endemic, that's around year over year.
Right. And we know how to deal with influenza. If it comes, we know what to do. We were caught off guard with COVID. I don't think anybody knew what to do. Like you said, brand new virus. What do you do? How do you deal with it?
Yeah, exactly. Yeah.
Okay. This is also interesting. Another one about testing. D asks, is the test we are using for COVID also testing for the presence of other coronaviruses, such as the common cold? And if so, are these test results separated?
So the answer is no. The common test that most people are going to get is related specifically to the SARS-CoV-2, the virus that causes COVID, and not all coronaviruses.
Okay. So there's no need to separate them then. Okay. Gerald asks, now that we've admitted that COVID is an aerosol, when are we going to recommend proper filtration and ventilation for indoor environments?
We're actually recommending that. We actually have information on our website on HVAC systems, increasing air exchanges, opening windows, even considerations for rooms that may not have any ventilation, no windows that can open, no HVAC. Maybe you need an air purifier in those rooms. So, and we've actually added information on ventilation in our guidance documents to businesses, to gyms, like to all kinds of sectors, recognizing that this is a really important thing that we need to keep an eye on for COVID.
Right, absolutely. Okay, this one is, again, we were talking about personal responsibility. Kate asks, a friend of mine works in a senior care home, so they get tested for COVID every 2 weeks, and so far they've been negative. So they think that they're not infected, they don't need to wear a mask, and they don't need to stay 6 feet apart. So does a negative test really mean that you don't need to wear a mask?
No, it doesn't. And a negative test should not give you that false sense of security that now you have a license to do whatever you want. Absolutely not. The negative test is as good on the day that you get it, but you can still, by not wearing your mask, by not keeping a physical distance, by being in close and crowded environments, get COVID. If you think, okay, I'm going to wait till my next test 2 weeks from now, well, in the meanwhile, you may have infected all kinds of people, including the very vulnerable people that you work with. And that's why we have to assume that anyone who we have contact with, that close contact with, that they're contagious at that very moment. And so that's why we have to put our precautions in place at every instance.
Right. And I feel like earlier you had also mentioned that now we're only testing symptomatic people, because there was a little bit of that happening in the summer where people were getting a test, they were negative, and they were like, yay, I'm going to go to the cottage, I'm going to go hang out with friends. And that kind of gave people license to do unsafe things.
And that's how we ended up in our second wave of the pandemic, that you could see the cases starting going up in the fall, very much related to what was going on. Mm-hmm.
Right. Okay. And that brings us to 1 o'clock. We've actually made a dent in our questions this week, but we'll save them for next week. Thank you to everybody that joined us and submitted your questions. We will definitely get to them next week. Thank you, Doctor, again for your time. And we'll see you next week.
Okay. Thanks. Bye.
Bye-bye.